All right, I won't take up too much more of your time, guys, as it is 12 o'clock, so we will get started. Good afternoon, and thank you for joining us today. My name is Kate Toomey, and I am the Sexual and Reproductive Health Project Officer at the Centre for Excellence in Rural Sexual Health, also known as CERSH. Welcome to the Virtual Women's Health Clinic webinar presented by Kim Lucas. Now, this is our last Sexual Wellness PD for 2025, but don't you guys worry, we will be back in February 2026. Before we begin, I would like to acknowledge the traditional owners of the lands and waterways across Victoria and Australia, which we are all joining from today. I'm joining from Dja Dja Wurrung country and would like to pay my respects to elders past, present, and emerging. And I'd also like to extend that respect to any Aboriginal and Torres Strait Islander people online with us today. I'd like to acknowledge the deep importance of Indigenous knowledge in the field of sexual and reproductive health. Wherever you are zooming in from today, you are on Aboriginal land, and it is important to note that sovereignty was never ceded. Now, before we get started, just a quick housekeeping note. We kindly ask everyone to stay on mute during the presentation, but please feel free to share your questions in the chat, as we'll have time at the very end to answer them. Also, it is important to note that this session is being recorded and will be available on the CERSH website next week. So if you'd like to revisit it or share it with your colleagues, you can. Now, I'd like to introduce our speaker, Kim Lucas, who is a sexual and reproductive health registered nurse at EACH. Kim is a dedicated and empathetic RN who has enjoyed providing healthcare across diverse settings such as Africa and Cambodia. She has many years' experience in MTOPs and theatre nursing stops, and most recently worked 3 years in the Wild West of rural GP land. During that time, she collaborated with 2 universities doing research and outreach programs for women's health advocacy, health education, and community empowerment. In her spare time, she is a mum of 5 kids and loves doing ceramics. Thank you, Kim, for joining us this afternoon, and over to you.
Thanks, Kate. Thanks, everyone, for having me during your lunch break today. It's really nice to be here. So welcome to some info about the Virtual Women's Health Clinic. Next page, please. I would like to acknowledge, and each would like to acknowledge the traditional custodians of the diverse lands, skies and waterways across Australia. We pay our respects to the elders past, present and emerging. We also extend our respect to all traditional owners and Aboriginal and Torres Strait Islander people, their elders, cultures, heritage and the right to determine their own future. And we also acknowledge the knowledge and skills of our Aboriginal and Torres Strait Islander awesome staff who currently are working at EACH and have previously worked at EACH too. So the virtual care is transforming how we connect, diagnose and treat, especially in remote and rural communities. Let's explore this evolving landscape of virtual health and discuss how free consultations are breaking down barriers to care. So here's our team. It's all female healthcare team, except our bicultural worker Cam. He is really supportive and pro women's health, so we're really lucky to have him. And just speaking about bicultural workers and cohort, I'm collaborating at the moment with the team at Enliven in EACH, and we're making some information flyers about the clinic that are going to be available in a whole lot of different languages that we can distribute to our cultural and language diverse cohorts. So send me an email if you would like some access to those, and we can pass them on your way. So how does sexual wellness fit into the virtual health clinic? As far as sexual health care goes, we do STI testing and treatment, contraception counselling, self-test cervical screening. So that's when we send the CST kits to people's homes, and they can do the collection in the comfort of their own home, and then they just post it on to the VCS. We give them a prepaid envelope. Reproductive support, that's advice with menstrual health, perimenopause, pregnancy options, abortion care, for MTOPs. And if our patient needs a STOPS, we give them the referral for a public hospital or the contact details for private clinics such as, Murray Stopes. Other services we provide, breast health care. In our patient welcome email, there's a link on how to perform a self breast exam, and the link includes, well, the email has a link that includes attachment for Breast Screen Victoria, so that the patient can then book online if they want to do that. And they also have an appointment with our doctor to discuss their issue further, and they might get a referral out of that for investigation if that's required moving forward. Our endo and pelvic pain care, in this space, the virtual space, this is really for patients at the start of their journey. So if they need referrals, medical investigations, some physio, dietitians, contraceptive or, contraception scripts, that sort of thing. We've got an endo and pelvic pain specialist nurse, Lily, and she works with us on a Friday for a half day. So that's someone really good to link in with there. But if patients are, 10 years down the track, they've got a chronic endo patient, this isn't really the right service for them. Each has got a specialist endo and pelvic pain clinic, and that's who I would refer them to speak to. We've also got a mental health counsellor and a physio, and we'll chat more about those later in the slides. So as you can see, no referral required. Patients can book directly with us via any of the avenues there. We've got doctors on board Monday to Friday, so our wait times have come right down. It's about a week, I would say, at the moment, which is great. But if there is time sensitive for an urgent MTOP or something like that, I always keep aside on the day emergency appointments that we can put people in with. So the appointments are all half an hour. And 15-minute for follow-ups. And usually with follow-ups, we can slot someone in within a day or two there. If they just need, for example, an ultrasound referral for an MTOP, we can usually pop them in pretty quickly there. So we believe that healthcare should be within everyone's reach. That's why all our virtual consultations are completely free of charge. We've now changed our perimenopause appointment times to 45 minutes. They were half an hour, but I found almost every woman that I'm speaking to is usually crying at some point and really needs to be heard. So we've really pushed that out and listened to them and pushed out the appointment times from 30 to 45 minutes, which I really love. I've also made a welcome email for most appointment types in the clinic. These are sent to the patient after their initial appointment with me and have really good information links that a patient can read and educate themselves about their health issue. So, for example, the perimenopause email has links about symptoms, info about HRT, natural alternatives, specialist dietitians. And in all of the emails I send out, I also include the link for the Jean Hales Her Health Check page. I'm not sure if you guys have seen that, but it's an awesome guide which includes health checks that you should have depending on what your age is. So if you haven't had a look, go and check that out. It's cool. Next slide, please. We have 5 free consults for Jackie. She's our mental health counsellor. She's available 1 day a week and she discusses with people perimenopause or endometriosis, general mental health questions and youth mental health for the girls that give us a call in the clinic. I usually don't refer MTOP patients to her because it's quite a specialised area and they usually have a lot of clinical questions. So with those patients, I refer them to the Melbourne pregnancy counsellors, and if they've got a GP referral, they can get their 3 free sessions there. Farah is our pelvic pain physio and she also provides continence support in that space. All of her consults free as well and they're held via video link. We've been getting a lot of really positive feedback from our patients about those. And just a quick story I'd like to share. We had a patient with a history of sexual abuse and she's also neurodivergent and not able to be physically touched by a healthcare worker. So for her being able to receive pelvic physio virtually in the safety of her own home has been an amazing game changer for her. And also on a Monday, we have our incredible nurse practitioner, Maria, and she works with us all day on a Monday. So that's been really great too. Next slide, please. So these are our current top 5. MTOPs, of course, number 1. It's closely followed by perimenopause at the moment. And these people are really seeking advice about symptoms and treatment. They want information, they want answers. So I often link these patients in with our mental health counsellor because they're at a time of life when there's a lot going on. They might have teenagers, elderly parents, they're still working, they might be running a farm, and they usually ring me crying, like I said. So at this point, it's really good to give them that free option of the counselling, and it's really positive in that whole holistic care aspect that we can provide. The endo and pelvic pain clinic, we use a really holistic care approach with these patients too. They usually will have an appointment with the nurse and the doctor, and then we'll link them in as well with our women's physio for assistance, and also our counsellor if they're experiencing any depression due to their diagnosis or assistance with the lifestyle of living in pain. We can also refer them on to specialist dietitians to help with that sort of consideration too, and of course referrals for investigative diagnostics if they need that as well. Contraception advice, that's usually pretty straightforward, giving education and scripts to people. And then the menstrual health, we speak to patients with irregular cycles, no bleeding, heavy bleeding, severe pain, and they often require GPs for further investigation and diagnosis there. This is just an interesting quick stats from June to August of this year. MTOPs are still number 1, and the main age group there is 20 to 29-year-olds. It's surprising how many people still are not on contraception who use a termination or a plan B as their contraception. Yeah, that's just a little side note. I guess the main age group, that 20 to 29, is our most popular cohort, but then I guess runner-up from that is the mums who often have young children, often breastfeeding, the old wives' tale of if you're breastfeeding, you can't get pregnant. So we often have women who are, got 3-month or 6-month or 12 months old, and they're seeking an MTOP. Next slide, please. So some factors that are contributing to the increase in women seeking our services. Convenience and accessibility is a huge one. The patients love having their appointment in the comfort of their own home. It cuts out long travel times or long wait times to see their GP if there's only one GP in town. Work-life balance. I have a lady on the phone talking to me about perimenopause the other day while she was hanging out the washing. It's such a good, flexible way of giving that healthcare to people, and also that continuity of care too. Improved digital health infrastructure, boost access, autonomy, patient outcomes. The COVID-19 impact has been really interesting in stats. Since COVID, there's been a 54% increase in virtual usage, particularly in women seeking virtual healthcare. And among Australians aged 45 and over, the virtual care has surged from 20 to 50%, showing a really broad demographic uptake there. Mental health support, like I've said, our counsellor, her wait times are usually around a week, so that's pretty good. Government policies and funding, thanks to the Victorian government, we're able to offer the virtual program. And privacy and reduction of stigma, that's a big one in our rural and remote cohort. Virtual consultations enhance the privacy and reduce stigma by allowing patients to speak with doctors and nurses outside of their local area. And this helps, ensure that they've got that confidentiality and trust, and makes it easier for them to speak with sensitive issues without fear of judgment or community gossip.
I think I'm good for paperwork this week.
Technology used, we have e-prescribing and e-ordering. So for patients that have Medicare, the doctors can send scripts, pathology requests, referrals, all that sort of thing to the patient's phone via an SMS or an email if they would prefer it that way. For our non-Medicare patients, we can email request forms to them, and then with their scripts, we just fax it to their chosen pharmacy, and then we can just post off the paper copy. Secure video conferencing, that's via AutoMed platform. E-signing for documents and consent forms. So once a patient has signed the form, it goes straight into their patient file, which is super handy for our MTOP patients, because I do a consult, the doctor does a consult, and then once we know that that patient is fully informed, the doctor just says, okay, can you please sign the form right now? And she just waits to receive it back. It's pretty much immediate. And then the doctor just gives her the script via SMS, and then we're done. It's super, super fast. And patients also receive SMS appointment reminders, patient forms, result reminders, all that sort of thing. So the healthcare forecast in Australia, this has been quite interesting. Market expansion, you can see from these numbers that the market is growing rapidly due to the increased demand for remote care and that strong government support. And there is better digital infrastructure happening. There's a rise in consumer preference for virtual consultations, especially in that rural and underserved areas. Another example of this recently is the launch of the virtual hospital program. So that'll be an interesting one to watch too. Policy and funding reform, the integration of virtual care, international pricing and funding models, and a national strategy is underway to standardise definitions, improve cost tracking and support innovation. Tech, increased use of AI diagnostics, wearable diagnostics, remote monitoring, and enhanced electronic health records. And the patient adoption trends, like I talked about before, there's been a real increased uptake, and Australians are increasingly comfortable with virtual care. Challenges ahead, particularly for rural and remote areas. They face major digital access gaps due to poor connectivity, limited infrastructure, and low digital literacy. And at the same time, data security concerns like privacy risks and low trust in digital platforms further discourage the online engagement in some patient cohorts. Emerging solutions include long-range wireless tech, mesh networks, and targeted government initiatives to improve inclusion and security. Why it matters, I really do consider my job a privilege, and I want all our patients to feel empowered, informed, and supported. So our clinic really does help to bridge gaps in access, especially for those in regional and remote areas, providing the timely care and reducing stigma around sexual and reproductive health for everybody. Thank you. I'm happy to answer any questions you guys may have.
Kim, thank you so much. That was fantastic.
Oh, thank
We
you.
do have a question in the chat at the moment, and it says,
Sure.
what is the funding model?
It is the state government has given us funding, which is why we're able to provide all of our consults for free. So I don't know any more about the funding model than that as far as what they mean. Because they still have to pay for all of their medication and that sort of thing. So it's just being able to provide the free consultations for all of the different healthcare providers we have. I should probably look into more detail about that though.
Melissa, you have your hand up. Do you have a question?
Yes, I do. I was just wondering, I don't know if you put it at the beginning because I missed the first couple of slides. Have you had a lot of people inquiring about self-collection for cervical screening? because I promote it all the time to groups to say, you know, even if you don't have a Medicare card or if you don't feel comfortable going to a GP to get the self-collection, you can call up and you can access this anywhere.
Absolutely. And the really nice thing about that is if the people, it's not English, isn't their first language, there's about, I don't know, 30 different description information about how to do the self-collect. So if we know that their language is Tamil, for example, we
Yes.
can print that out and pop it into the kit for them so that they will
Yeah.
be able to read that in their own language. So it's really easy. We just get a path form and then pop it in there, send it off to them. There's a self-addressed envelope that they put it into,
Mhm.
read the instructions, just fill out a few little things. They need to fill out, you know, their name and that sort of thing on the actual tube. And then they just send all of that on to BCS. So it's
Right.
quite simple for them. Yeah,
Thank you.
pleasure.
Fabulous. We have another question about larks. As they are the most effective contraception, how do you promote or refer for these procedures?
Really good question. We really promote them heavily here. So if it is a person that is able to get to our sexual reproductive health hub here in Ringwood, we offer them that an appointment that they can then come and get it here, or I usually promote or point them in the direction of their nearest sexual health hub and give them those details. Or if they know that their GP can do the service, there is, you know, it is limited with the GPs, but if they know that they can get that done there, then we can just give them a script. They can go to the chemist and then make the booking with, yeah, either their sexual health hub or their GP, or come to us if they're around here.
Fabulous. We have a question on referrals. Someone just missed how people can refer to your service, and is there an age limit with referrals?
No age limit. Well, age limit as in it can be 100, 101. I suppose the bottom range of that, our youngest patient we have seen is a 12-year-old. I guess there is like a little bit of a grey line crossover between what you would consider pediatrics and what you would consider our space. So I think it's more when you start talking about sexual reproductive health, I guess it is people in that sort of puberty zone onwards. Um, what was the other part of that question? Sorry, the start.
How people can refer to your service.
Oh, okay. They don't need to refer, but if they want to, they can just pass on our phone number or get them to give them the virtual health clinic, like go through each pathway there, and they can make an online booking. They can fill out an inquiry form, or yeah, the best way is just to ring us and make an appointment.
Fabulous. I have another question. Given the service is state funded, is it accessible for people who do not live in Victoria?
No, we only, because we're only funded for Victoria, we only assist women, girls and gender diverse people in Victoria. We have had a couple of calls from New South Wales and one from Queensland, but of course, not only can we not help them, well, we're not supposed to because of the funding. The issue is also I can't really help with sort of like the cohort of if someone wants to know something about where their nearest sexual health hub is in Queensland, because I'm down here in Victoria. So I did get on Google and try and help these women anyway, but it's not something that we really are getting into at this stage.
We have a question about interpreters. Can you guys work with them, and how does it work logistically?
Yeah, good question. Absolutely, we do. Usually, we find that someone needs an interpreter when they give our number a call, and usually they can sort of say enough to our admin team to be able to say, you know, Spanish interpreter or something like that. And then we will just give Language Loop a call and then just ring them back straight away with an interpreter and us and make further appointments, or if we've got a session, we can quickly chat to them then. So we do work quite closely with different interpreters, and it's no problem at all for any of us. The doctors do it all the time as well, no issue.
We have a question about, can you talk to the pathways for early medical abortion? Do barriers persist?
Yes, absolutely. I could talk all day about this. At the moment, unfortunately, we don't offer early medical abortion. All of our GP team does want an ultrasound prior to giving the scripts for MS2 step. So I guess if somebody, particularly our non-Medicare patients, where looking for an MTOP can be $700-800 and more, I usually find that I refer them to somewhere like Sexual Health Victoria or one of the health hubs that does do VEMA, just so that we can keep that cost down for them as far as the ultrasounds go. I hope, this is just my hope, I only want to speak for myself when I say this and nobody else in the virtual clinic, that I do hope that things turn around and that we can start providing early medical abortion in the future, because I think that it is the way to go, and it does reduce that time barrier, the cost barrier, there's just so many different barriers that women are up against all the time. And even I had a patient last week, they finally got everything done, went to the chemist with their script, and then the chemist told them, no, we can't help you. You need to drive for an hour to go and get it somewhere else. So there is barriers pretty much at every stage of a woman trying to get a medical termination. Yeah, so that's why I guess we're here trying to do our best and provide the least amount of time possible that somebody has to wait to get one.
Thanks, Kim. I also have one last question in the chat. For those women with disabilities, communication barriers such as deafness, is the service accessible? Can they access it via talk to text?
Yeah, this is an interesting one. We had a patient who was deaf, and it was we were able to help her, but in this case, because she needed to lip read and it didn't translate all that well over video, we did end up suggesting that I think a face-to-face consultation would have been more beneficial for her. We could try it and see if it worked. I guess it depends on her issue as well, what her presentation was. But definitely, if we could try it and make it work, then we would.
Fabulous. Thank you, Kim. Does anyone have any last questions? I will give you guys a couple seconds to write in the chat if anyone does, but if not, thank you all for joining us, and thank you, Kim, for that presentation. I
My
hope you
pleasure.
guys enjoyed it, and we hope to see you back in 2026. Thank you, guys.
Absolutely. Thank you. And anyone, feel free to just call us or shoot me an email if you would like any further information. We're here.
Lauren, was that a question about slides? Yep. Kim, are you happy if I can share the slides?
100%. Go for it.
Thanks, Kim.
Good
What's your
question.
email?
Yeah. I'll just give you the generalized email. It's VWHC, as in Virtual Women's Health Clinic, @each.com.au. Or mine is kim.lucas, LUCAS, @each.com.au. And our direct line is 8827 3250. that's a really good one to call us on. I know there is a 1300 number as well that is published, but I think it's better if you call the direct line so that then you get straight to us and we can help you immediately.
Fabulous. Thank you, Kim.
My pleasure. Thank you for having me, and thanks everyone for tuning in.
Thank you.
Thank you.